I have a 12-year-old young lady that I'm working with, and she broke her foot in two places about 4 years ago, and her foot has been swollen ever since, about 4 times the size of her other foot. I've seen her about 4 times now and have gotten the swelling reduced this way, but not this way on her foot. I'm wondering, what else can I do?
There's two options, and the most common is that the bone are not completely back in place. And when bone are not in place, the lymphatic are mapping, and you have an inflammation probably then, and the lymphatic are mapping those bone that are not adjusted back in place. So those dysfunction, you have to work on the bone. And we have a class called fluid articular release, FAR, that will help you put the bones in place. The bones in the joint, but in the fracture, sometimes it's outside of between the joints. So you have intra-osseous technique and inter-osseous technique. And this is something that when you don't have crack, so that's why I'm teaching it, so you can do it within your scope of practice. That's number one. And then the fact there's venous and lymphatics, maybe a lot of that going to resolve once everything is back in place. Number two, you may have discovered a primary lymphedema, so a dysfunction of the lymphatics that is often discovered around that age or a little bit later. Often when you have a trauma, a fracture or something like this, the lymphatics, like any other time, try to drain, and you just realize you don't have enough lymphatics to drain a bigger inflammation than normal. That will entail a lot of diagnostic, and while putting the bone in place will take you 10, 15 minutes, and you'll have a pretty good idea if it's good or not. And if you put the bone in place and 99% is resolved, you don't have to make an exploration. But if it doesn't stop, it's nice to know that if she has a primary lymphedema, know that then you're going to have to take precaution so it doesn't get infected, and you'll know that there's other things to do, basically. Does it make sense?
Yeah, awesome. Thank you.